Well, welcome to Irvine and California. Eliminating the barriers to achieve equitable quality health care in our nation and achieving the triple aim of better care, improving the health of the population and the community, and affordable care requires an understanding of the principles that will be articulated in our workshop today. My name is Bernie Rosof. I'm chair of the IOM Committee on Health Literacy, and I'd like to welcome everybody to today's workshop. I also want to let everyone know that this meeting is being recorded and videotaped for webcast across the internet. So we will pay attention to that factor. The mission of the Roundtable on Health Literacy is to inspire and activate a wide variety of stakeholders to develop, to implement, and share evidence-based health literacy practices and policies with the goal of improving the health and well-being of all people. And we should kind of remember that as we go through our exercises, both today and tomorrow, that part of the effort is implementation. As one of the major activities, the Roundtable sponsors workshops for members and the public to discuss issues of importance and concern, such as the focus of today's workshop. The complexity of healthcare delivery in this ever-changing environment requires more than an evidence-based approach, more than measures that matter, more than a robust IT infrastructure, more than choosing wisely and a learning health system. To that very important list, we must add person-family-centered care, shared decision-making, and to accomplish this, we must understand certain basics, specifically integrating health literacy, cultural competency, and language access services. As we know, the demographic makeup of the United States is also rapidly changing. The aging and evolving racial and ethnic composition of the United States population, as we were just discussing up here a moment ago, has placed the nation in the midst of a profound demographic shift. And healthcare organizations face many issues as they move to address and adapt to this change. In order to adequately serve the community and adequately serve the population, healthcare organizations are looking for approaches that will enable them to provide information and services to all people, all persons, in a manner that facilitates understanding and use of that information to make appropriate health decisions. One of the 6 aims for improving health care is to provide care that is equitable, that is, care that does not vary in quality because of personal characteristics such as gender, ethnicity, geographic location, and socioeconomic status. Increasing health equity and reducing health disparities requires aligning healthcare system demands and complexities with individual skills and abilities, similar to what I mentioned a few moments ago. Such alignment requires attention to the integration of health literacy, cultural competency, and language access, which, as you know, is the subject of this workshop for today. The workshop was organized by a planning committee, the members of which are Marin Allen, Dennis Androulis, Wilma Alvarado-Little, Ignatius Bao, Jem Dowse, Alicia Fernandez, Suzanne LeLauren, Janet Oheen Frempong, and Winston Wong. Let me say at the onset, I want to thank all the members of that planning committee for a job extremely well done, as we will all see in a short while. I also would like to ask Roundtable members who are here this morning to be thinking carefully as the day goes by about key points you think are important to highlight because at the end of the day, I'll be asking each of you to provide us with 1 or 2 sentences about important points made. And if we could relate that to the mission of the Roundtable, that may be helpful because tomorrow's conversation will encounter some of those details. To begin the workshop, we're going to hear from Dr. Dennis Androulis, who will talk with us about how the Affordable Care Act and other incentives facilitate the integration of health literacy, cultural competency, and language access services. We have asked Roundtable staff member Melissa French. Melissa, where are you? There you are. Just raise your hand a little higher. to give us, each speaker, a 5-minute, 2-minute, and a time is up warning so that we can keep ourselves pretty much on time. Makes my life a little bit easier. We will please hold questions for Dr. Androulis until after we hear from the first panel. Dr. Androulis is a senior research scientist at the Texas Health Institute. He is a leader in the field, developing initiatives at both the state and national level that address issues on health care for vulnerable populations, racial and ethnic disparities, and cultural competence. A more detailed biosketch is included in the handout. Dr. Androulis, welcome.